Welcome back, everyone, to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today, we have the team from Independence Now joining us to share information about their organisation and how they have a positive impact in the community. I'm going to ask the team to introduce themselves. Shannon, would you please introduce yourself?
Hello, everyone. I am Shannon Minnick. I am the Director of Independent Living Services here at Independence Now.
Thank you. Welcome. Serena, would you introduce yourself?
Hi, everyone. My name is Serena Jarris. I am the COVID Services Coordinator here at Independence Now.
Thank you. And Sarah, would you please introduce yourself?
The Executive Director of Independence Now.
Thank you. Welcome, and it's terrific to have you here. So now that we've met the team, I'm going to start interviewing them, and so we can all learn about their programming. So, could you please outline the core services for Independence Now?
Okay, so at Independence Now, we have 5 core services. Our first core service is peer counseling. We provide and serve as role models to our consumers. We help them we assist them with exploring all of the possibilities of life. Our second core service is self-advocacy. Advocacy really is self-advocacy and system advocacy. Self-advocacy, we assist our consumers and educate them on how to advocate for themselves in their community. System advocacy is exactly what it says, system advocacy. We also go out into our communities and meet with our local and state federal legislators and advocate for the things that persons with disabilities need. Independent living skills training, we host a series of events. Now, due to COVID, they're all happening online, but we educate our consumers on how to live independently in their communities and in their homes. So we talk a lot about transportation, employment. We help them with budgeting, and we also have a cooking class. We provide information and referrals. What information referral is, you can call us about anything and everything related to disability. A lot of our calls are really about housing. A lot of our calls are definitely about housing. Housing is very strenuous right now. Folks need housing, and it's very difficult. So we provide information and resources on how they can apply for housing or other services that they need in the community.
Thank you so much, Shannon. So your organisation is unique. It is part of the Centre for Independent Living, and that is different from other disability service organisations. Could you step our audience through how they can better understand that?
Thanks. So Centers for Independent Living are different in that, one, we're part of a network. We're not standalone. We are standalone organizations, but we're part of a network. There are 7 in Maryland. There are hundreds nationwide, and we receive state and federal funding to provide the core services that Shannon outlined to people to disabled people. And ideologically, Centers for Independent Living are really firm on the idea that people with disabilities are the best experts on their disabilities, on their care. And so it's run largely by people with disabilities and always for people with disabilities. And allies and families are always really welcome to participate, but our emphasis is always the disabled person, to the best of their ability, will direct their path, whatever they want their path to be. And that is one of the things that makes us very different, because our advocacy, we are not being advocated on behalf of, it's not as many parents groups and things like that. It's very disability person focused. So disabled person focus. Yeah.
Thank you. That's a really good, solid understanding. So we heard earlier from Shannon, and she talked about advocacy. What are some of the top advocacy issues that you're currently working on?
My favorite question. So Independence Now has done a lot of work on housing advocacy. In about the last 5 years, we've gotten much more engaged. Many of you may know that most housing advocacy happens at the county level. So we work a lot in Montgomery County and Prince George's County, as we serve both, to try to increase the number of affordable and accessible housing units that are available to people with disabilities and other people with very low incomes. So we've done a lot of work on housing. Right now, some of our other focuses tend to be related to the pandemic. So we've been doing some work around food insecurities. A lot of our consumers have experienced not being able to get out to the store, not being safe to do that sort of shopping right now, and then utilize public transportation at the minute. And so we've been doing some food delivery and trying to make sure everyone's well connected with the food that is available near where they live and that can be delivered to them. That's the key part. We're also doing some work on technology as people are home much more and want to be engaged and connected through all the various events that Shannon mentioned. Those are all happening on the Zoom platform. And so we're trying to purchase some technology and get it into the hands of people so that they can, do telehealth visits and order groceries and other supplies and participate and be engaged both with their families and maybe with other things that they used to do, like go to church or come to the Independence Now events that they haven't been able to get out and do. And then another one that I would include would be around, maybe I'll just stop there for now. Yeah, that's a lot of advocacy. So
Yeah, totally understand it. And particularly at the moment, we have so much need for advocacy across the board. And, a lot of things that we were advocating in the past have now been layered on top of everything associated with COVID. So let's dive into the day-to-day operations of Independence Now. There are going to be folk who are watching this or listening to it, and they're going to be saying, okay, how's Independence Now going to impact my life? So I think it would be good to know what happens when someone, just themselves, they contact Independence Now and seek services. What happens?
So initially, when someone contacts Independence Now, usually it's through me, and I'll decide which IO specialist they will go to, because Independence Now, we serve Prince George's and Montgomery County. So we have a full-time IO specialist for both counties. And once that happens and the individual has scheduled an appointment, right now because of COVID, our office is closed, yes. But usually when an individual comes into our office, they're greeted by a person with a disability. And that's when, it really starts to sink in. It's like, oh, okay, this person with a disability works. Usually, they come in and they have an idea of what they want to work on. But then when they see you and they realize that, they can work. That's a huge thing. And as they go down the hall, that's all they really want to see is people with disabilities working. So it's very, very empowering. I know when I applied for my job at Independence Now, I knew about them, but to come in and to see, all these individuals that are working is very, very empowering. So once they get to the individual that's going to be supporting them, they sit down and they have a discussion. What it is that you want, what it is that you need. And then that individual will help them set up goals. So they'll help them set up goals and they'll help them with the steps to reach those goals. And sometimes, a goal for me may take 2 days, but for the next individual, it may take a year. So we also meet people where they are and, kind of schedule the ending, when they reach that goal, to be realistic on time. So, pretty much that's what it is. They come in, they schedule goals, they work through their goals, they plan, you know, what the timetable of reaching that goal, and then the IO specialist will continue to support them and call them and help them reach that goal.
It sounds like Independence Now is very focused on that piece called mentoring.
Yes. Yes.
Not doing for people, but actually mentoring them to achieve
be able
their
to
goals.
do it themselves. Yes, that is
Oh.
very important because, you know, so individuals come in and they may become, say someone come in and they meet with me, they may become attached to me. And so I start working with them to reach a goal, and I'm doing the work for them. When I leave, the next person isn't going to do that. So I need to set them up so they're able to do these things on their own. I think that's the most empowering thing. I take away the power from that person if I'm doing it. I give them the power and the tools that they're doing.
Excellent. And what you are saying is that you are that first point of contact. Would you mind sharing your contact details? And I'll also include that on the Engage at Home list.
So again, my name is Shannon Minnick. My phone number is 240-638-0070. And my email is sminnick, MINNICK, @nnow.org. And there's many ways to get connected with Independence Now. Look us up on social media. A lot of folks are, you know, on social media now. So look us up on social media. I always tell people, if you want to know what an organization is really doing, look them up on their social media. But look us up on social media. You can connect with us through our website. If you don't want to call in and feel a little shy, you can just go in and put in a referral on our website, or you can just pick up the phone and call me.
Beautiful. And as I said, I will put all these contact details in the description with this interview. This is a great interview, and I really appreciate you joining me today. So we are in challenging times at the moment, and you know, everything that was normal has sort of gone out of the window, but there are also issues that are really affecting the broader community, and then very specifically members of our community, which include the folk who are engaged with Independence Now. Serena, could you give us a little bit of an information about some of the topical areas that you're working on right now?
Thank you. Independence Now is really excited to engage with the moment, and it's not just the moment, it's obviously historically. Black, disabled, people of color, and specifically Black disabled people of color, face pretty historic and systemic barriers, interactions with police, accessing healthcare, living in the community safely and independently as is their right. And Independence Now is really excited to not just have these necessary and difficult conversations, but to move these conversations forward into action. You know, engaging with our community stakeholders, teachers, social workers, doctors, police officers, making sure that they can better interact, have safer and more nuanced and better interactions with people with disabilities, and building up these platforms so that disability activists can have their, better amplify their message. And so Independence Now is really excited to engage with this work of Black Disabled Lives Matter, because many of our consumers are Black, many of our consumers are at the intersection of poverty, disability, and race, and it's important that as an organization embedded, we are the community, we are embedded in the community, that we're supporting them and making sure that they feel safe, supported, and that they can thrive, and that they know they have a partner in us. And we're excited to really be doing this work.
I love the way that you describe that intersectionality and that piece, that this is not new work to you, but you're now engaging with it at a time when there really does need to be thoughtful community partners.
Mhm.
Yeah. And this program does have caregivers who are part of our audience, and I'm sure that there are going to be many of them who are curious to know how Independence Now could be an asset as part of their toolkit. Sarah, would you mind giving us information about that?
Sure. We take several thousand information and referral calls every year. And so I think that's a huge benefit to caregivers who are maybe not sure where to turn, don't know the next call to make. Many of our service delivery systems are just thick with bureaucracy that's complicated to understand. And I think there can be real benefit to calling Independence Now, talking with our independent living staff who are experts in picking apart those steps and figuring out who to get you to, what's the best place to start, here's all the information you're going to need to have to really lower the stress. Caregivers have a lot on them to take care of, and I think it can be helpful to have someone who's been through that, likely personally at our organization, unlike others. Our staff have personally been through accessing these services and know people to call and have walked through them alongside others. So we encourage you to, give Shannon a call, and she can direct you on any area. We help people access Medicaid. We help people understand other benefits. We can direct you to employment benefits and opportunities and services. So I think we can really be of service to caregivers that way.
Thanks, Sarah. Shannon, would you please remind folk of your contact details?
Sure, thank you. My number is 240-638-0070. My email is sminnick@inn.org.
Wonderful, thank you. And just to remind folk that I will be putting all of the Independence Now contact details in the description of the Engage at Home interview. We've reached the end of our time together today. It's been a fabulous interview. And what I'd really like now is for each of you to have a final word, share your wisdom with our audience. Sarah, would you like to go first?
Sure. Well, thanks so much for having us. It's been a pleasure to talk with everyone and share a little more about Independence Now. I wanted to mention one last service and resource that we may be able to be to caregivers and to people with disabilities and members of the aging community in Montgomery County is that we do some work with assistive technology and home modifications. We sometimes have funds available if people qualify for those funds income-wise, but we also have a staff person who's just very knowledgeable about assistive technology and home modification. She has good contacts with contractors in the community who do aging in place home modifications, which can be important to keeping people in their homes as long as possible, hopefully forever. And we have a ramp program that people can borrow ramps, metal foldable ramps from our office. And we're soon to have a lending library where we'll have a number of different pieces of assistive technology that during COVID we'll probably be mailing to people, but then in the future when our office reopens, they'll be available for people to come and check out in case there's something that you're trying to make a little bit easier and have a little bit more independence with. We'll have some items in our office to look at. So thanks.
Thanks, Sarah. Serena, what are your words of wisdom?
Thank you again so much for having me. And as the COVID services coordinator, a lot of people don't really know what that means, and they don't know how that fits in with their life. And I get a lot of calls on I'm feeling isolated, I'm feeling lonely, and people can be embarrassed about that. They can feel like I shouldn't be complaining, I don't have it as bad, but I want to make it very clear that we are here for you. If you just need someone to talk to, if you want to talk about your day, it doesn't have to be a specific service. Feel free to call us. It's a really difficult time, particularly if you can't leave your house, if you can't be with your family and friends. And we definitely know what you're going through. We are not immune to this because we are staff. We empathize completely. I know I empathize. So even if you feel like you maybe don't directly have a hard service that you need, feel free to contact us, because we have this really robust online programming. We have one-on-one, and we're so happy to talk with you and engage with you.
Beautiful, well put. And Shannon, final word for you.
Thank you again for me as well for having us here. I think I want to say that you are the best authority over your own life. It's time to take control. If you are feeling like someone is, taking control, there's no late time, no late time. You always can take control over your own life. Call us, let us help you, let us support you in reaching your goals. And as Serena said, there's so many events that are going on at Independence now. You really don't have to become a consumer. Go on to our website, look at our calendar, pick and choose what you want to do, and just click on the link and come in and join us, and you'll find that you want to be around us. We are a very powerful organization, and our voices are loud, and we need your voice as well. And get out there and vote.
You make us roar. So thank you, Shannon. That's so amazingly said.
Thank you.
So I want to thank everyone for taking the time today to be here, to really connect with this amazing organization, Independence Now. This has been a great interview, and I'm inspired by what you all have said. I want to thank our audience for taking the time to bring Engage at Home into your life. And I want to remind everyone, during these times of uncertainty and frustration, to stay healthy and calm.